Hi everyone, welcome back to the Dr. Sia channel. In the video here today, we're going to be replying to a request from one of the viewers here saying, how can we reach our emotions? Let's get started. All right, so how can we reach our unreachable emotions that sit there in the depth of our bodies and so on and so forth? A lot of us are repressed, are suppressed, are unable to, or believe that we just for whatever reason must not be allowed to experience our feelings. Now, what can we do about that? First of all, I want to say something. There's very few human beings on this planet who feel nothing. Very few. Feelings are anything you can feel with your body. Hunger, thirst, tired, horny, happy, sad, angry, guilty, so on and so forth. Fear. So we can all feel something, right? We can all feel something. Now the question is, what can you not feel? And what are you not allowed to feel? And in ISTDP and in attachment literature, what seems to be what is not allowed to feel or what is not felt is not singular feelings. So single feelings can often be felt. Some sadness, some anger, some something can be felt. What often is the problem is to reach a sense of complexity in feelings, is to be able to feel when there are opposing feelings occurring or conflicting feelings occurring, or so to speak, complex feelings. Right? So complex feelings is when there are opposing or combating or seemingly feelings that pull us two different directions. For example, a friend of mine might yell at me and they might accuse me of something that I haven't done. Now, I love this friend, so I have love for this friend. I feel the love. I have love. When I see you, if you're my friend, if you're out there, you're watching this, I love you. All right? But when you hurt me, anger comes up in me as a response to the pain. Now here, my love for you and my anger towards you is causing complexity. They're tearing me two different ways. My ability to hold these two feelings within me, to have my love for you and at the same time express my anger towards what you've done, is called the ability to experience complex feelings. This, however, this ability to experience complex feelings is something not everyone has. And in fact, 30 to 40% of people are not able to experience complex emotions. They can experience feelings one at a time at various levels and degrees, but not two at the same time. This is often what we are avoiding. And indeed, with avoidant attachment, ambivalent attachment, and disorganized attachment, it's these complexities that we are avoiding. It's these complexities that make us avoidant and ambivalent and disorganized in behavior. It's when the person who's avoidant all of a sudden has a friend who hurts them, and rather than expressing their anger towards the friend, they might just walk off. They might go fully with the anger bit. Forget that they love the person to begin with. I've been with you for 2 years, you hurt me one time, I'm out. That's where the ambivalent person might attack themselves. Oh, I'm so useless, aren't I? Yeah, I always get it wrong. Again, to pull on the person's love and care rather than just being angry. This is where the disorganized person might freak out, start yelling, start swearing, maybe even get violent or get self-harming. Because again, they can't tolerate the complexity in the feelings. So when we are talking about reaching into our feelings, when we're talking about experiencing our emotions, there's really one proven, trialed, evidenced way of doing that. And it is through surpassing our defense mechanisms. See, our defense mechanisms are there to ensure that we feel consistently with our attachments. If attachments are sort of the why, then our defense mechanisms are the how. I regularly help my patients overcome their defense mechanisms so that they can feel their feelings, tolerate the complexity of their feelings that they have. These patients then say things like, oh, now that I've put all of my defense mechanisms aside and I have built this capacity with you to feel, I feel so much more. Life feels so much more. So, by and large, how do we do it? We work in therapy with the person who's an expert at dealing with defense mechanisms, and they help you put these aside. Now, if you don't have that, I recommend you get a book on defense mechanisms. Start recognizing your own defense mechanisms. There are really great books out there. A lot of them. Just go on Amazon. Defense mechanisms. And there's a book called The Lies We Tell Ourselves by John Fredrickson. That's a really good book. There's a book called Reaching Through Resistance by Alan Abbas. That's a really good book. There's a book called Co-Creating Change and Co-Creating Safety, again by John Fredrickson, really good books. Patricia Cogbin, who's also here on YouTube, has really great books on identifying defense mechanisms and so on and so forth. So there's a lot of good resources there that you can check. And hey, if nothing else, you can check my channel. I got playlists and playlists of defense mechanisms and how you can identify them and how you can start doing the work for yourself at home. I hope you appreciate the video. Where did that come from? I don't know. I hope you appreciate the video. It doesn't really actually matter. I'm still going to do this. I'm a crazy person. I just keep making these videos thinking that people actually are interested. I'm sure there's people out there interested. There are people who watch them. Let me know if you're interested. Let me know if you actually find these videos useful. Thank you very much, and I'll see you again for the next one. I hope you appreciate it. Show me your appreciation. Funny.